Hi, so I'm doing a presentation on the community health promotion by Christian Reyes, myself, California State University, St. Marcos, Nursing 370 Health Promotion Patient Education Strategies. Professor Michael Gilmore, MSN, ED, RN, PHN, October 15, 2017. So we were talking about the problem, which is about there was a survey done in a California women prison where they showed a high incidence of hypertension. So blood pressure of 140 over greater than 140 over 90. And the healthcare team there, they asked a group of nurses to help them develop a health promotion, health teaching plan for screening and educate women on hypertension, just kind of help controlling it and treatment. So being in prison can cause hypertension, just being due to stress, diet, age, and just other factors that may happen. Next is that ever since nursing school, I've known that hypertension is known to be called a silent killer, just because there's no really distinct uh, sign or symptom for it. Learning needs assessment. Assess. We have to assess the patient's cognitive abilities on learning, such as, for example, do they learn at a 4th grade level, 8th grade level, or even college level? We need to assess what they know about hypertension, what information. Do they know the causes, the effects, the treatments, and the signs and symptoms? How about we need to assess, are they willing to learn about the self-health management? Are they ready to learn, and are they willing to change their lifestyle? Next is we need to able to identify barriers on preventing on health promotion, such as being in a jail. They might have restrictions on diet and freedom of exercising. Next is health promotion model. Health promotion model that I used was the PRECEDE PROCEED health promotion model. So PRECEDE stands for predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. So it just involves the social assessment, epidemiological assessment, and ecological assessment. Just to sum it up, it just kind of assesses the social problems they may have in their population. We need to identify their problems and set goals. Any behavioral or environmental lifestyle that relates to them. And what we do is we put all that in consideration, and we want to match the appropriate interventions for them. And we're going to implement those interventions. Next is the PROCEED. What PROCEED stands for is policy, regulatory, and organizational constructs in educational environmental development. It basically involves the implementation, process evaluation, impact evaluation, and outcome evaluation. Summing that up is implementation, just the interventions that we used. Process evaluation, just dealing with if we achieve their goals, did you change their behaviors, and did they have a negative behavior or a positive behavior for them. So the reason I choose this PRECEDE PROCEED health promotion model is because it enforces many factors before implementing an intervention. So it just kind of makes sure that we assessed everything about the patient. Next is health promotion, health education plan. So the goal that I set was I want them to lower the blood pressure by 5 millimercuries of pressure within 3 months. So say if they're 140 over 90, I want them to be 135 over 85. 3 behavioral outcomes that I want them to do is they will perform physical activity for at least 45 minutes a day, which physical activity can help reduce blood pressure. I want them to consume a healthier diet and reduce salt intake, since salt intake high salt intake correlates with higher blood pressure. Next is reducing stress and perform relaxation techniques. It's just it shows that studies shows that stress can increase blood pressure. So as nurses, we are at risk for high blood pressure. Next is research and evidence. I have done I looked up at 3 articles. First one was the effect of educational programs on hypertension management. It explained the effectiveness of educational programs regarding their level of knowledge, lifestyle change, and blood pressure among hypertension patients. So with this study, it just promoted education and evaluated what they learned. Next is hypertension management in primary care. What they did was they improved hypertension control, evaluate effectiveness of physician-manager education for hypertension management. What this study used, used implementation of a positive influence from a physician-manager. Next is the risk factors of blood pressure among young adults. Hypertension is associated with increased risk of stroke and heart attacks, and the study just shows the treatments and what we should do to prevent these other diseases from happening. Evaluation. I did 3 evaluations. Formative evaluation, which is such as examples achieving goals such as lowering the BP, which I said earlier, by 5 millimeters of pressure in 3 months. Next is outcome evaluation. It's the patient will achieve a different lifestyle, a healthy lifestyle, such as eating healthy and physical exercise. And last evaluation was impact. It's the patient will provide information regarding hypertension, such as preventions, treatments, and some signs and symptoms. Conclusion. So this is basically just some positive ways that we could help control blood pressure. What we want to do is regularly check our blood pressure by a blood pressure machine, just to monitor to see if it's not too that it's not too high, and if it is too high, we might need to go for a checkup. Avoid smoking or alcohol, of course, because those correlate with increasing blood pressure. Another one, like I said earlier, was eating healthy and less sodium intake. And the one I also mentioned earlier was preventing stress or doing relaxation techniques. And losing weight. Losing weight kind of relates to everything here, because if you eat healthy, you will lose weight or do exercise. And these are just my references regarding reference I've done with this presentation. All right, thank you.